Okay, today we're going to be treating our patient in between the eyebrows and the forehead, and then we're going to treat the upper lip to treat what she feels is a gummy smile. We'll inject Botox / Xeomin into the corrugator muscles in between the eyebrows. Now we'll get rid of the 11s, and then we'll go up onto the forehead. And when we treat the forehead, this is where you're more likely to hear the crunch. The crunch is good, just means I'm getting into the muscle where it's more effective. And we'll treat her so that she has an attractive brow lift, not a Spock look. We'll put a little bit more here in the middle. Alrighty. So we're going to be injecting Botox and Xeomin up into the upper lip to keep the upper lip from going up too high, which causes a gummy smile. The alternatives are that we can break the upper jaw and reduce the size of the upper jaw so that there's less of a gummy smile, but this is obviously a little easier way to do it. Patient's a little nervous, so she's squeezing on a breast implant, and we'll go ahead and get started now. Alrighty, we're putting small aliquots of the injection on both sides, two points on either side of the upper lip. So here's a little bit goes in there. And this just relaxes these muscles so that the upper lip doesn't go up as high during a smile, so it shows less gum. And then this also affects the ability to suck out of a straw potentially. It doesn't always, but it can. But you know, since we're relaxing these muscles, it affects anything the upper lip does. So maybe when you smile, you don't have as much of a gummy lip, but also it can affect your ability to suck out of a straw, which if you don't suck out of a straw, it's not that big of a deal. In case any of you out there have a gummy smile and you think you're the only one, you're not the only one. We just had one patient we treated. Now we're going to be treating a second patient this morning with a gummy smile. All right, go ahead and smile for us. So, very pretty patient, don't get me wrong, but she's just anxious about how she shows more of her gums than she'd like when she smiles. Go ahead and relax now. And one of the things the patient noticed that when she smiles, this side comes up higher, so we're going to actually distribute a little bit more to that side. We've treated this patient before, so I'm okay with, you know, doing a little bit asymmetrical injections to improve the symmetry. But if it's the first time I'm seeing a patient, then I probably wouldn't do that. I'd want to get an idea of their baseline first before we inject more on one side versus another.